Hi, this is related to this patient called Manik Miya who was operated here. I had got a call from West Bengal asking for from a patient who was operated here successfully and who had gone back. So he told me that I have a patient who has a brain tumor and doctors back here in our state are telling it's quite complicated. That was the time I told him that you can send them to Akshaya Multispeciality hospital and we will get the imaging done and then see what best I can do. So this Mr. Manik Miya was referred here to our institute and I immediately asked Dr. Karthik to have a look at this patient, and he told that patient should be operated upon very urgently, quite a complicated tumor, and that is how he was brought from Bangalore, and the rest is for you all to witness and see how well this whole thing was performed, and the patient is absolutely fine and ready to be discharged. I thank and I congratulate Dr. Karthik and his neuro team for doing such a fabulous work, and I wish him all success, and I hope that in the coming years there would be many more successful surgeries and a lot of patients could benefit from this. Thank you.
Myself, Dr. Karthik. I'm a neurosurgeon and minimally invasive spine surgeon. So today I'll be talking about a patient who came with a history of intractable headache, and it was suggestive of a raised intracranial pressure, and we got an MRI done, MRI brain with contrast, which showed a large right frontal intraaxial mass. It was a ring enhancing with an irregular wall with severe perilegional edema, and there was a midline shift also. So let me just show you the MRI film. So this is the MRI brain with contrast, which shows this is the enhancing solid component. It's an intraaxial mass over here in the right frontal lobe, and it has also got spread into the right lateral ventricular wall over here. So this is the growing end, and it is growing into the right lateral ventricular wall also, and it is causing a midline shift towards the left side. So this is the tumor over here, this is the enhancing component, this is the edema over here. So now we did a right frontal craniotomy and completely excised the tumor, and the patient is doing well after surgery, and we also got a scan done after surgery which shows complete excision of the tumor. So this is the CT brain with contrast, which shows complete excision of the tumor. This is the tumor cavity, excision cavity over here, and we had entered the right lateral ventricular at the time of surgery. So it has been completely excised, and the midline shift also is much better, and the patient also is doing good. So here the presentation is a young male with history of headache and double vision. So the take-over message or take-home message is any patient or any person with a severe headache and with a double vision, be it in the young age group or in adult also, with significant vomiting. So first we need to do an imaging of the brain to rule out any intracranial neoplasms, like it could be a brain tumor, it could be a glioma, or it can be a meningioma also, or it can be a posterior fossa tumor.
আমি একজন বাঙালি পেশেন্ট, আমার বাড়ি কুচবিহার, ওয়েস্ট বেঙ্গল। তো আমি ওইখানে প্রথমে সিটি স্ক্যান করি। সিটি স্ক্যান করার পর মাথা সেরকম তখন আমরা কোনো কিছু টের পাইনি। তারপর আমি এইখানে ব্যাঙ্গালোরে আসি। ব্যাঙ্গালোরে এসে এখানে কার্তিক স্যারের সঙ্গে একটা চিনে পরিচয় হয়। তারপর আমি অক্ষয় হসপিটালে আসি। আসার পর এখানে আমার চিকিৎসাপাতি হয় আর কি, অপারেশন হয়। মোটামুটি এখন আমি সুস্থতা ফিল করছি আর কি। আমি কার্তিক স্যারকে অনেক ধন্যবাদ জানাই। উনি আগামী দিনে আরও সাকসেসফুল অর্জন করুক।